Okay, so what we're going to do is that we're going to start off up there by just looking at that side joint straight down, so lining up the anterior posterior joint lines. So oblique towards yourself. Oblique towards yourself. Too much. So that's good enough, right? So we're just trying to get the anterior posterior joint lines. And now what we're going to do is we'll come to the lower portion of the joint, and essentially we're going to go from kind of a lateral to medial, medial to lateral, right at that joint. So you see kind of how we're along that medial border, and now I'm actually hitting bone. I'm going to redirect this to make the needle kind of rest, like, actually not even that. I want it to go and be really along that medial portion of the joint. That's almost there. Just like that. Okay? So that's going to be my first needle place. My second needle and my third and my fourth and my fifth and so on and so forth are going to be right next to that on the skin. You kind of sit adjacent to that. Okay? And our purpose, that's actually a perfect position right there. Our purpose is to really kind of stack them next to each other at about, 8 millimeters or so of a distance and kind of follow it all the way along. The question that was asked me last time, though, was, how do you know that's 8 millimeters, right? I mean, how do you know that's 8 millimeters? Well, realistically, you kind of almost like eyeball it at the skin. Okay? By the time that it gets to the image, you don't know if that image is bad, you don't know how high, how far the image intensifier is from the actual joint, and so you really can't quite tell the actual amount of space that you have between the needles. But you can go and kind of gauge it a little bit up there at the skin. You can go and tell where you are. Okay? How many needle placements do you do? Remember what I told you, right? It depends, the needle placements depend on who's paying for the needles. If the hospital's paying for it, then it's going to be a little more needles than when I'm paying for it. So the point is this though, that really honestly, take a look at this. Take a look at this, guys. So this right here is going to be how you're going to go about the actual lesioning of your needles. Okay. So essentially, you have 1, 2, 3, 4, 5, 6, 7, 8 needles that are placed. And again, 8 needles, if you took a look at that and you extrapolated another 6 needles, that's going to go and get about the lower 2/3 of our joint. And that's really what's the most meaningful portion of the joint itself, okay? That's where most of the load is, and that's kind of where that's going to be. So you place those 8 needles, 1, 2, 3, 4, 5, 6, 7, 8, and then these probes are going to go in, okay? And you put in your 4 probes, 4 probes at a time that you can do. And you can only lesion between 2 of those probes. Okay? So you're going to go lesion, bipolar, right there, okay? And now, what you're going to end up doing is, you're going to actually go in and replace one of those needles right up here, okay, for 5, and you're going to go lesion and lesion, okay? And then you're going to replace 3 of those needles to 6, 7, 8. You're going to go on lesion, and then switch the probes and lesions. Okay? So you're going to go and do enough lesions that you can go and kind of do all that. But the beauty is, the reason that I use 8 is because if I place those 8 needles to start off with, then I can go and just kind of switch my probes out in between and not have to go and do anything else with my needles. And just go and get that lesion all the way across.